Causes of disease. Smoking when young may cause breast cancer in women. Women who are using birth control pills or injectable forms of birth control called Depo, otherwise known as Depo-Provera, have a slightly greater risk of breast cancer. Being overweight or obese after menopause or because of overweight gain that took place as a young adult is linked to a higher risk of breast cancer. Taking estrogen and progesterone after menopause, sometimes called combined hormone therapy, increase the risk of getting breast cancer. The use of alcohol is clearly linked and increased risk of getting breast cancer. These are just a few causes of breast cancer. The main cause is unknown. Who's at risk? Breast cancer is about 100 times more common in women than in men. Women who begin having periods before age 12 or went through the change of life, menopause, after age 55 have a slightly increased risk of breast cancer. White women are slightly more likely to get breast cancer than African American women. African American women, though, are more likely to die of breast cancer. Women who have had radiation treatment to the chest area as treatment for another cancer as a child or young adult have a greatly increased risk of breast cancer. Women who have not had children or had their first child after age 30 have a slightly higher risk.
Signs and symptoms. Breast cancer symptoms vary widely, from lumps to swelling to skin changes. Many breast cancer patients also have no symptoms at all. Symptoms that are similar to those of breast cancer may be the result of non-cancerous conditions like infection or a cyst. Other symptoms of breast cancer include nipple discharge, enlargement of one breast, dimpling of the breast surfaces, an orange peel texture to the skin, unintentional weight loss, enlarged lymph nodes in the armpit, and visible veins on the breasts. If you experience any of those symptoms, you should see your doctors. A breast self-exam should be part of your monthly healthcare routine, and you should visit your doctor if you experience breast changes. If you are over 40 or at a risk for the disease, you should also have an annual mammogram and a physical exam by the doctor. The earlier breast cancer is found and diagnosed, the better chances you have at beating it.
Diagnoses for breast cancer. They can do an MRI, a ductogram, core needle biopsy, needle aspiration biopsy, mammograms, tomosynthesis, and a sonography, which is an ultrasound. And all these, and there are also more that can be done to diagnose breast cancer. Treatment and prognosis. First treatment would be surgery, radiation therapy, chemotherapy, hormone treatments, targeted therapy, and bone-directed therapy. Based on the previous outcome of past numbers of those who had the disease, and depending on what stage it is found in, determines the treatment and the prognosis. 5 years has been the observed survival rate, but some are fortunate to live longer.
Hopefully, after watching our show, you have learned a little bit about breast cancer. It is greatly important for all women to do a self-monthly examination of both breasts. It is best to do it when you're in the shower and with soap. Therefore, you can slide across the breast, making sure you get everything. It is important to do it in the same direction. If you're going to do it in circles, do it in circles. If you're going to do it in zigzag, do it in zigzag. Therefore, you get the entire breast and you won't miss anything. If you have any questions, please contact your doctor. Thanks for watching.